just kind of chat, and then I give you some. We have a bunch of women waiting to ask you questions too. So I'm not sure
No,
how this
that
will look. Did I lose you?
sure. No, I can hear you just fine. And
Okay,
what
good.
I want you to do, Darby, is you go ahead and lead, and I will go ahead and answer the questions as they come. And you certainly, just like you have done very well in the past, kind of make this as effective and efficient as possible so that
Okay,
we
what
can
I did,
maximize.
sorry, what I did was I just have been going through the group, and the questions that keep coming up,
Yes,
I wrote those so we could just give them to you. We have an echo. Uh-oh, spaghettios. Okay. Maybe if I
that
try
is
to take
much
the
better.
heads. It is. Okay,
Yeah.
good.
Yeah.
Wow.
If you
Okay.
bring it
Oh.
closer, I can hear you much better.
Okay, like that.
Yes,
Okay, let me just adjust this a little bit and we'll see if that's better. Good.
yes.
Please mute my desk. Okay, I'll close my desktop. But you probably hear birds in the background. I'm outside.
Mhm.
So that might be what you hear. We have a whole zoo back here. So, okay, good. What was that?
Yes.
So
All
is
right. I
this
can hear
being
you just fine, Darby. Yes.
okay? Okay, is this being recorded and it will be on the live, or when we go live it starts from that point? I'm
No,
new to
from what
this.
I've been told, we are actually live. We have six guests that are on, and I'm sure as we move forward, the other guests will be on. So, from what I have just been told, Lori just told me we are actually on Facebook Live, so everyone is
Okay,
listening.
great. Oh, yay. Hello, everybody. Okay, so this is just a new way we're doing everything. Um, so bear with me. I don't really see any questions or anything popping up. So we're using something called Be Live today because unfortunately, Facebook has done away with the ability to have guests on live. So I've been taking notes of a lot of the questions that I've seen in the group, and let me introduce myself and our lovely guest, of course, Dr. Khan, who is a BII
Thank you.
surgeon. And he gives so generously of his time and helps just answer questions just out of the goodness of his heart. So we appreciate you being here. My name
No,
is
thank you very
Darby.
much. Thanks for having me.
Yes, of course. My name is Darby, and I have a group called Breast Implant Illness, Detox, and Healing. And obviously, I have my own journey. And the reason I started this group was so that we could learn to detox and speak freely, because a lot of groups are really highly censored, and I try to keep it a free forum so that everyone can just share love and experiences and honesty, really. So I have a bunch of questions for Dr. Khan, and we were just going to kind of roll into them. I'm sorry, I was going to try to keep my laptop open, but I think it was creating an echo. And if we can confirm that, if not, then I can actually answer questions. That's why I had the laptop. So maybe Alicia can let you know what she thinks. Oh, I can keep it open. Yay! Okay, thank you. Okay, good. We have a whole team helping us today. Thank goodness.
Sure. No, credit goes to Alicia. She's the mastermind and the genius behind this. As you can imagine,
Woohoo!
last week we had some technical issues. So thank you very much, Alicia, for setting this up. She's been truly wonderful and instrumental in all of this.
Okay, I'm going to try to hold my headset up to my mouth here. We're getting a little echo, and it's probably from where I'm sitting. But yes, we had a hard time last week. I had no clue that we were no longer able to do guests, and we tried and tried, and we had so many lovely guests, really try to jump on here. So I'm going to make sure that on my page that when we're live, I don't actually see it, but that we're open to the public, because that's the only thing I was worried about. Alicia, I don't know if you can check that, but on my page, I don't see it here on my page. So I'm not sure where they're going to see us. But anyway, make sure it's not private, I guess. I've made that mistake in the past, and then no one could really see what we were chatting about. So is this on your page, Dr. Khan? I'm not sure where
Uh,
we're at.
I do not know. Alicia, maybe can tell us if you could please type on whose page we are on.
And I can
Um,
always
s-
share
uh,
it. I can always share it. Okay, it's Dr. Khan's page.
oh,
Okay, well, I'll share it afterwards then. So we'll just get
okay.
chatting anyway. So some of the questions that I've seen a lot recently. One lady asked me specifically to ask you, what are the biggest symptoms and factors that you see when diagnosing breast implant illness. And let me tell you why I asked that, because we have a lot of women that aren't sure if they're dealing with it or not, and they join and say, I don't know if this is my problem. How do I diagnose it? And I always say, it's kind of one of those things where you have to go down a checklist. And we thought,
Yes.
who better to ask, you know? So let
So
us
that's
know
a
what you
very
think.
good question. So that's a very good question. And, there are patients that come in and they are vague. They're not sure if they want to make this investment, especially their significant others. Now, as we
Sure.
all know, and this has been established over and over and over again, there are no specific lab tests, no imaging modalities, MRIs, mammograms, ultrasounds, whatever it may be, no specific
Wow.
lab tests, even inflammatory markers, for example, or white blood cell count, whatever it may be, that will point or indicate towards that this is breast implant illness. And for
It won't?
me,
It won't, you said,
it
or
will
it will?
not. There is nothing.
Ah,
There is nothing, no lab
wow.
out there. For example, let's say, for example, lab X, for example, it may be, or a positive ANA, or whatever it may be. There is actually nothing, no lab test, believe it or not, that has being done that
Wow.
will indicate or point or be suggestive of breast implant illness. Now, these are labs that have been done at, for example, the Mayo Clinic, at the major medical centers, repeated time in, time over, so many times, multiple times, 5 times, 10 times. There's so many patients that have been to the emergency room that have had all the lab work up done, and all of that has been inconclusive. And this is why
Wow.
this breast implant illness continues to defy us. Now, one thing that I say
Wow.
with complete certainty, and I use the word certainty, is the fact that when you have a 26-year-old lady, young and healthy, never had any issues with anything, nice workup, which has been like diabetes is negative or no rheumatological problems, all of those factors are negative. But she comes in, and I actually have a questionnaire where I literally break down the symptoms into the many different organ systems. We start off with brain fog, fatigue, joint
Yeah.
problems, weight loss, weight gain, hair loss, amongst the many, many other problems where I try to gauge and see what are the sign symptoms in
Yeah.
what I
Wow.
call the pattern recognition, where what on earth would cause this 26-year-old nice, pleasant lady who should be at the peak of her health to be all of a sudden overcome with all these sign symptoms that are burdening her. And I
So it's an
say to these,
accumulative.
exactly. So, and this is where I asked the lady, you get up at 2 in the morning and you start talking or listening to some of these ladies that say, I had joint problem, neck pain, vision problems, and I
Lyme's
never had any of
disease,
them. Lyme
rheumatoid
disease type symptoms,
arthritis.
exactly. Rheumatoid
Yeah.
arthritis, where my doc said that I have fibromyalgia, where my doc said I have psych problems, anxiety, depression, amongst the
Right.
many and or the many of these sign symptoms, what they call, if you cannot think of anything, you can always blame it on a psychiatric issue or you can blame it on fibromyalgia, because that's essentially like the waist bag syndrome, where you can essentially, that's like the final common denominator. This is the final diagnosis, because it is essentially, if you cannot think of anything, this is what it boils down to. And many of the ladies would attest that this is what their rheumatologist ultimately concluded. So going back to the pattern recognition, where you can say all of the workup is negative, the patient
Right.
is, and I post these videos on my, and like the ladies that have mentioned in your Facebook, where all of a sudden, before they were experiencing these sign symptoms, they had the eyes, the basically the rashes on the face, and then literally hours after, all of a sudden you see one patient after another, dramatic recoveries. So the point being, we know with definitive certainties that this is essentially breast implant illness. Now, what I have done is I have asked the ladies that come in who have done their research, who have been on the web, and they have looked and discussed and seen my symptoms are pretty much the same as my friend or my other new friend that I met through Facebook in Miami,
Yeah.
who went and underwent this explantation done right, and all of her sudden symptoms improved, because we know this the same series and the same pattern that these patients are experiencing, some more with visual, some more with joint pain, some more with the rashes, for example. and more or less the same connective tissue type disturbances that the manufacturers themselves have mentioned and discussed. And
And
we
all
know
the
this,
inflammation. It's like
all the
all that
inflammation.
you look
Right,
10 years
exactly.
younger within a week of just removing it. You look 10 years
Exactly.
younger.
Exactly. So all of these signs, symptoms, like for example, tachycardia. One of my patients mentioned that her heart symptoms improved, like her heart was always racing, and this goes along with the anxiety, the shortness of breath, for example. So going back to answering your question, it is this overall evaluation, this questionnaire that kind of gives me a good deep understanding as to what it is. And this is what I mentioned in my top 10 things. What women need to have done is to have had their due diligence, have been to a primary care doctor, so they have done their own like battery of tests, so that we have ruled out that, this one of these other patients may have had, like say, a thyroid issue. And millions of people who
Right.
do not have implants have thyroid issues. So we want to make sure
Sure.
that we're not attributing or masking this to breast implant illness, and that
Yeah.
when I do operate, I've had a medical clearance by almost every single patient, so that when I know moving forward it is breast implant illness. And I tell all my ladies, time will prove to us how fast and how significantly you're going to bounce back. And I tell them, well, it has to be breast implant illness, because that's exactly the same story it was for the last lady and the lady before and the tens of thousands of other ladies who have come forward. And I say this, if you just go within the last 1 month, I've had at least 6 or 7 ladies that have come forward and that they have shared on Facebook
Well,
and on YouTube, and they have been generous enough to say, wow, on my drive home I could see clearly the signs. The next day when I
wow.
got up, I had no joint pain. And I say this to them, thanks for sharing, because this is the proof that your patient has, your friend has, who was on Facebook, your member, so that she can say, you know what,
We're
hopefully this is
sharing.
my
We're
case. Yes,
sharing, right?
exactly, exactly, because
Now
that's the
really
only
quick.
thing we have. That's unfortunately the only thing we have to go by.
Now there's two things really quick. Is one is I actually have an anecdotal survey for this on my I have a nonprofit for breast implant illness on lemonadegroup.org, and it's LEMAID, lemon, LEMONAID, lemonade.org. And you can go there and just do it, and it gives you an idea of all the symptoms that you might be dealing with, everything from parasites to, and it gives you an idea, and it's just there just to give you a little feedback. Also, what is the name of the group that you have? You have a group, and I know a lot of people love to follow you. They just love your enthusiasm. What is the name
Sure.
of the group that you have?
Yes. So I have the KHAN Plastic Surgery Academy. We can see most of my operative videos, how I like to dissect and how I like to basically discuss with the patients the post-op recoveries, for example, the intra-op and pre-op findings that are significant that I want to share with my patients. The other thing is the breast implant illness support group by Dr. Shahar Khan, board certified plastic surgeon, so that the patients can follow along and they can share and discuss, the findings post-operatively. And what I say immediately post-operatively, we're looking at literally hours after the surgery, so that we can discuss some of the other patients' experiences about twilight sedation, the indication to proceed with, why one should get, for example, an MRI before the surgery, and why the other person should get genetic testing, for example, because these are important discussions to have and the workup before we proceed with surgery. So to answer your question, Khan Plastic Surgery Academy on the YouTube channel, and then Breast Implant Illness Support Group by Dr. Shahar Khan. Darby, can you hear me? Yes, Darby, can you hear me? I can hear you now.
Okay, you can't. I lost you for a second. So funny. Breast implant. I don't know what happened. Breast
So
implant
breast,
illness. Tell
yeah,
me.
Breast Implant Illness Support Group by Shahar Khan, and then also Khan Plastic Surgery Academy, where you have the YouTube videos and discussions and patient testimonials in regards to their recovery.
Okay, I'm looking for you now because I don't actually have us live, and I know everyone in my group is waiting to hear from you, and I am not finding you. So I don't. Oh my gosh, I don't know what's going on. Can you still see me, Dr. Khan?
And I can hear you as well.
Okay, good. Well then, I don't know. I'm just gonna have to share it afterwards. There's always a
Okay.
technical difficulty. Okay, so my next question is, and that a lot of doctors have different ideas of their when to stop supplements or when to restart supplements, because a lot of these women are being their biggest advocate, and they're doing a lot of herbs or they're doing a lot of natural stuff to heal their body. And we had this discussion going for a little while because some doctors say a week prior to surgery, some say 3 or 4 weeks prior to surgery. What do you think about that? What do you think is a good time for that?
So supplements, majority are should be supplementing or getting in our regular diet, a full control like a diet, even if you're a
Yeah,
vegetarian.
but a lot of
Yeah.
these women are detoxing with charcoal, things like this. So, of course that, but we do, the group is about detoxing. The body doesn't naturally detox some of these problems, unfortunately, heavy metals and things, especially those women that have the MTHFR gene. And those women are the ones that are really focusing on, when can they start this, their heavy metal detoxes
So
or things.
so majority of these supplements we do not know what they are because there is over God knows 200, 300 different types of supplements, different quantities, different
Sure.
chemical compositions, and we do not know what's in it. Now sometimes these are anticoagulative, which means that makes the blood very thin. We don't want these patients to take it, and we most of these are made overseas too. So we do not know the quality of the make. And so sometimes there is a very high concentration. And remember, these are not FDA regulated, majority of them. This is essentially a $1 billion industry. And I say to my patients, if you eat a regular diet, there is no reason, unless you have a vitamin C deficiency, for example. Now, supplements, for example, vitamin D in someone who is postmenopausal, very much indicated, not only the vitamin D, but the calcium in order to maintain and prevent osteoporosis, for example. And this is also dictated by the physician, the primary care doctor. So that need not be stopped. Patients who are, for example, on the psoriasis medications, they need to continue their medications because that is a prescription strength and very much indicated. What I'm
Right.
talking about, someone who's taking herbal medications, medications like garlic, over the counter medications made in China of that and the regulation. So we don't want to harm or hurt the body because these supplements certainly do affect the coagulation, for example, the healing properties, and sometimes if taken in excess, they can cause toxicity. Now,
Right.
going back to your question about charcoal, when is charcoal used the most? Now, as a board certified general surgeon who's, done and understood the GI tract, done colonoscopies and EGDs and colon resections, what is the proper utilization of charcoal? When someone ingests, for example, aspirin accidentally, or a suicidal, patient, for example, they go to the emergency room and all of a sudden they're given charcoal because what it does is it binds to the chemicals within the GI tract and essentially decompose, allows for the body to basically absorb those toxins that is still within the GI tract so that the patient can essentially eliminate that from the rectum and
Right.
the anus. If someone takes charcoal, it's not going to allow for physiologically the blood to be cleansed, if you will. The only true way in order to do that, for example, would be dialysis. The patients who undergo dialysis, patients who have had kidney failure, chelating agents, for example, or over time, the liver in itself will detox these heavy metals, and the
Mine
kidney will,
didn't. Mine didn't. The
though, but
charcoal made
you,
a huge difference for me. I used it
how
personally.
How do you know it made a big difference? And again, this is a good discussion.
Yeah, I tested before and after. For me personally, my detox group is because I started detoxing myself, and I tested all along the way because my metals were actually completely through the roof. My chemicals were through the roof. I had parasites that were through the roof. My entire body system had shut down. My
How do
hormonal
you,
system.
sure. Now let me be the devil's advocate. How did you know
Sure.
you had the parasites?
I got blood done, and they were in my blood. Yeah, it was. It's very gross, and I don't
I know, no,
usually.
no. It is.
The
I will say
it's
in
so it's
medicine,
gross.
in in medicine, I want to say, we and deal with this on a daily basis. So it's very
Sure.
important for us.
But
You know,
as a lady, it's gross. It's
I know,
terrible.
no,
But
I can.
I talk about it in my group all the time because what happens is the body system just completely shuts down. So what I've learned, I've been dealing with this for a long time, obviously, and I was my own advocate. And I learned a lot, and I did a lot of different. I did blood tests, and you talked earlier about the heart issues. I was in the emergency room 3 times for what I thought I was having a heart attack. I mean, everything mimicking a heart attack. My whole side went numb. And then even a couple times I had slurred speech. We thought I was having a stroke. There was a lot of issues. And so I just started to peel it back, and I got blood work done. I got every kind of testing, like most of these women that, that are dealing with this. And I'll tell you what, I understand the medical world versus the natural world. I understand
Yes,
that, and there's a deep appreciation for all the medical world, but I do know that there is a lot of natural stuff that has changed my life completely. I mean, I went from having parasites in my blood, such heavy metals that my hair was falling out, that they were completely out the roof. I've had them tested 3 times since the beginning and then throughout, and as soon as my metals went down, I started getting pregnant. So that told me
this
that it
is when you
was,
had the explantation done.
yes, but I had to I detox those metals. I did a whole protocol that I wrote for detoxing metals specifically. A lot of it was food based, but things naturally like cilantro. There was a lot of food based, but my coppers were so incredibly high, which is linked to anxiety and postpartum depression. My first baby, I had such bad anxiety that I became a shut-in. I didn't even want to leave the house. I couldn't even have a normal conversation with people. I was so full
Sure.
of anxiety. I didn't even recognize myself. But vitamin C, like you said, I was completely robbed of vitamin C, and vitamin C is one of the only supplements that actually draws out copper. And I did tons and tons and tons of vitamin C, and I could feel a difference within months, and my copper went down significantly.
See, can I jump in, Darby? Now, this is
Yes,
when you
yes,
say you did tons of vitamin C, you could certainly, and then again, please don't get me wrong.
sure.
As a physician and, as a biochemist in my training, if you take, and again, this is something, and I'm very happy and glad that everything worked out well for you, but there are levels of vitamin C, D, among all of these, vitamin B12, for example, which are an integral part. But sometimes you don't want to, and again, this is not for you, but for the general
Sure.
audience and everyone who's listening, you could certainly get vitamin C toxicity because everything has to be in moderation.
Well,
If there's
it wasn't
less,
like 100,000
I
milligrams
know,
a
no, I
day.
got you, no, I got you,
It
and
was food. It was food based vitamin C, and it was never more than 2,000 milligrams a day, and it wasn't more than weeks at a time. You know what I'm
sure.
saying?
But
It
I
was
say,
obviously not. Yeah.
I say to my patients, there's nothing like having a good orange lemon and just eating a regular diet, and that the body in itself will replenish whatever it needs, and there
I
will
wish
never
mine
be
did
a
that. I wish mine did that.
yeah. And
I
so
really do.
and I say this with no, there's no questions. There is the silicone
Yeah.
that
Sure.
leaches into the body, that the composition of the silicone with the many metals that we know of and many that we don't even know of, like platinum, copper, and amongst the
Yeah.
many these heavy metals. So there are patients who certainly will, who are, for example, because they're depressed, for example, or they're anxious, they might not have a good optimal diet. They may need these supplementations, but one has to be very careful when it comes to taking these supplements so that you're not overdosing. And if one has a regular healthy diet, the body in itself will absorb whatever it needs, and the excess essentially will be eliminated. And one may not need the supplements. And again, this is a topic in itself and something
Sure.
that needs to be
And I
heavily
and
looked
I
at and
and
studied.
I
Yeah.
appreciate that. And I
Yes.
appreciate that. And
Now,
yes,
one thing I want to say is, again, from my experience, a lady came, very nice lady. She was actually on a cover of a magazine, like a model. And
mhm.
guess what? She came in, she had supplements, 20 bottles.
That's
God
typical for breast
knows.
implant illness.
Yeah, yeah. And then some of it was made overseas. And this lady
Yeah,
was spending
I don't buy
almost two to
anything
three
overseas.
thousand
Yeah.
dollars worth of supplements, and she was doing everything possible in an effort to detoxify herself. And I said to
Sure.
her, please, we need to definitely stop this because this is something that might actually hurt you rather than benefit. And she was in her middle age and just having a regular diet because I did not want any complications such as bleeding, hematoma, whatever it may be as a result of these medications.
All right. Well, thank you for that information on that. And so I do want to jump to the next question because this one I thought was really interesting. So,
Yes.
have you noticed, because obviously there's so many different breast implants, and in the group I've noticed that women that are dealing with gummy bears seem to have more acute symptoms and they come on stronger. And I was wondering if you have any, if you've seen, as far as the different implants go, if you're seeing a different pattern for different side effects or symptoms, because in the group we've talked about it a few times, it seems like there's a pattern, and I'm wondering if you've seen
I
anything
myself
like that.
I myself have not noticed the gummy bear versus the regular silicone or the textured, for example, or the saline implants.
Right.
I myself have not. I will tell you, there are ladies that I have met and seen taken care of who had pretty much almost all the sign symptoms checked on my questionnaire, and they had just what you would call the benign saline
Saline.
implants, and there's no such
Wow.
thing as saline. And you would think the textured implant lady would be the one who would be experiencing them. No, and this lady, for example, had them
Interesting.
just like 2 weeks, and she started reacting to my surprise. So the body in itself, some mask and live happily with gummy bears for a really
Yeah.
long time, and basically they have no sign symptoms, and
Just depends
they
on the
have a rupture.
person.
Yeah, it
Yeah.
just depends on the person and how they react.
All right.
And I just
Interesting.
want to clarify as well, there's no such thing. Well, the gummy bears or textured are dangerous and they cause lymphoma, whereas the saline are more innocent and more benign. I say to everyone, saline implants are like
Mhm.
yeah. So there are a lot of patients, as you have seen and you have talked to, who have saline implants
I had
and who
saline. Hmm.
have and who were suicidal and had all the joint problems and amongst all the problems you can imagine. And you would think at least the saline should rupture, or the implant before that fluid would look in. And this was the very minimal amount of whatever leaching that there was from an intact saline implant that would continue and harm the patients.
Wow, that doesn't surprise me. I mean, I that doesn't surprise me. I had saline. I've had so many women say, "But saline are safe." And I said, "What do you think is around?" Most people don't know. And then same thing, like you said, the platinum. That one, I had a woman message me privately. She's in a class action suit because of platinum, and she asked that I don't mention her name, but because apparently they used platinum in chemotherapy in the 70s, and
Right, right,
it completely tears down the neurological system. And
right.
so that explains so much. I personally had all type of neurological issues. I had um, neuropathy happening in my toes and in my hands, and I've completely turned it around naturally. um, you know I I have, not just by food, Dr. Khan, but I've
Mhm.
absolutely turned it around. I mean, I couldn't feel my toes. It was so painful if I would bump
No,
something, my
this is very
fingers.
true. So one of the symptoms, young lady comes in again in her 20s, 30s, 40s, even 60s, numbness, tingling on the fingertips and the toes, and they want to go ahead and get MRIs to make sure there is no pinched nerve, amongst the many things. And all of a sudden, their carpal tunnel type symptoms improve, like literally as soon as the explant is done right. And if I may mention, Darby,
That's not
the
what happened to
best.
me. It took 3 years of me
Yeah, no,
detoxing, just so
sometimes they take longer. Sometimes, you see some of these patients' testimonials within 6 days, for example, that I posted. I just want to say this very importantly, the best detoxification is to remove the entire capsule 100% so that there is
Yeah.
no capsule remaining. Because if you leave that burden behind, that whatever that is leached out will stay in the capsule and will continue to mount and harm the body. And so it is extremely important that the capsule be removed in its entirety, definitively 100%.
Now, that is something that we talk about a lot, and I just want to expand on that. Actually, in the group, when I see women, I'll ask how everyone's doing. We get about 1,000 members a month. That's about how fast the group grows, and that is one thing that I see a lot with the women is the ones that are still really dealing with issues still have some capsule in there. Not every single time, but they're the ones that didn't get an end block. They're the ones
Right.
that ended up, and that is such an interesting statistic. And I'm not saying it's every single person, but I'm saying the ones that are telling me they don't feel any different after explant, because there are some that still deal with that, issues afterwards, but it's a smaller percentage. But uh, for some reason, some of the other groups have really kind of hushed them up. And I feel like, well, what's the whole point of having a support group if we can't hear what everybody's feeling and going
Absolutely.
through?
Everyone needs to see, you have to have full disclosure. We're trying to learn.
Yeah,
We're
right.
trying to just share information here. So it is very, very important. The question ultimately boils down to this, Darby, because you and I have had discussions, phone discussions, where you have said this doc explanted my friend in an
Yeah,
hour and a half of 2 hours. And
right.
I will tell you that virtually is not possible because I myself, on average, take 4 hours, 5.5 hours at times.
And most
Look, there are
doctors
some
do.
videos. Yeah.
Yeah,
And so you have to rely and the sixth sense, like someone mentioned the other day, your gut instinct. You have to ask the doctor, do you believe in breast implant illness? And if the doctor says yes, you want the proof. Now there's five, six proofs that you have. And if I just may mention, because this essentially will be the gist of the Facebook Live. Number one, the doctor is so serious in believing the breast implant illness that he or she is not augmenting. Because why would anyone want to harm someone and it's also at the same time say that I believe in breast implant illness, because they cannot go hand in hand. So the reputation
yeah.
of the surgeon is key. Like Dr. Chun, for example, like Dr. Feng, and I used my colleagues, my examples who I look up to, who have stopped augmenting. And they only explant and they do it right, and they go around the country giving lectures, talking, discussions,
That's
going out of
wonderful.
their way to make sure, and that is exactly the reputation of the surgeon. So that's why on the Facebook Live, if someone says my surgeon spent an hour and a half and he did 6 explants in a day and he was done by 4, red flag, stay away. Number two, the incision. If you're, and just like you and I have discussed, Darby, before, if you have an incision that's 2 or 3 centimeters, how can you get an end block from that, like a sealing implant out of that? As you can see, you have to have at least 8, 9, 10 centimeters, depending on the size of the implant. If you have a 615
That's good to
cc
know.
implant,
That's a good
you
little deal to
cannot
know. Yeah,
get it out from a 3 centimeter. Impossible unless you're
right.
Houdini. Number three, you have to have the pictures not only of the capsules themselves, i.e., with the end block, but also of the chest wall, I say, in addition to the pictures, so that you can see with absolute certainty that on the chest wall there is no more residual capsule remaining.
I had a
It is
picture,
not,
and it was extra skin. There was tons of extra capsule from my ribs that had been stuck. I mean, so you
no,
could
you do
tell
not want to
everything
remove
was
it.
removed. Yeah, everything, all
Yeah,
the
so you
capsule
want to
was
make
removed.
sure. No, ideally, so going back to this, you want to see the picture of the entire implant
Right.
and block that it was done, preferably a
Intact,
video,
yes.
but also you want to make sure that you get a picture of the chest so that there is proof that there is nothing remaining. And I will say
That's
this
good
very
to know.
importantly, it is not good to just get your bovine and to burn that tissue, because guess what? That coagulum forms on top, and guess what? The silica is still there. That's cutting corners, and this is not ideal. And I will definitely not recommend. Physically, you have to remove, if needed, the fascia off of the rib cage in order to
That's what
truly
happened to me.
remove the
Yeah.
capsule. Yeah,
It
because
was
if that was
painful.
not, Yes, yes, yes. And you know what? And I say this to my patients, if you don't feel the pain, that means your surgery was not done right. If your surgeon spent 2 or hour and a half or 2 hours, like you and I talked about, another surgeon did a end block and a lift in 3 hours. I will do a lift in 3 hours alone, let alone the end block in itself, 3, 4 hours. So the point I'm trying to make here is that
That
the
that always
pictures need to be
scares
taken.
everybody. When I post
Yes.
that up, I
No,
always get people, mine only
no,
took two
but you know
hours.
what?
I'm
I will tell you
sorry.
what is worse, to
Not knowing,
get
yeah.
that capsule remaining behind, you not bouncing back, having the patients invested 6, 10, 12K, whatever it was, traveling,
Yeah,
and then to be stuck with the same situation again where the
I
capsules were
know.
left on the chest
It's
wall. That is by
heartbreaking.
far the worst of all the situations because you're still sick and you accomplish essentially nothing. Obviously, getting the implant out might be some of a relief, but obviously you left the capsule behind and the burden is left behind. Number four, uh, the surgeon must be committed into returning the implants back to the patient because you know if you got a saline implant that was intact, that's one of the proofs. Because majority of the surgeons, what they do is they rupture the implant deliberately, purposefully. It collapses, and then through a small incision, the dissection is much easier, and then they remove wherever the capsule that remains.
I just
So
saw
it is
someone in the group say that today, that they want to deflate the implants before they'll remove them. And I think this person doesn't even know what they're doing. If they're willing to
then
do
they
that,
see they do not understand what breast implant illness is.
no, they
Or there
don't.
is another doc that a video was made aware to me by one of the patients where she did a beautiful end block, and she showed the videos that the whole implant plus capsule is one ball, one piece. And guess what, right on the patient's chest she opened up the capsule and there was a ruptured
Why?
implant, and guess what, it
Why?
was it was like honey all over, and this was on the bovie, the pickup. And she did state that I'm going to remove my gloves, but I guess what, that small amount gets into the chest wall. There is no way on earth that that surgeon is going to
But
be able to
why?
remove.
Why do
I
that?
you know
Why would
this
you do
is,
that?
I will tell you, she truly did not comprehend, understand what exactly breast implant illness is. And this is the whole purpose.
That's
And
sad.
that's why in my many videos I mentioned when the patient has physically left the operating room, then only do I cut it out because technically it is non sterile, or if it's ruptured or whatever, I do not want to potentially contaminate the patient's skin, even.
Good for
And
you.
so that's why it's important. And so it is. And now the other thing that I say to everyone is, each one of us now is on Facebook, social media, Instagram, whatever it may be, and we're talking
Yeah.
about me. We're talking about the other explant surgeon. We're talking about the other explant surgeon in North Carolina, in Florida. And we now have a reputation that is very closely followed. And it's amazing to me that as I see one patient, she says, I know the next two patients who are coming and they're from different parts of the town and they are talking because they know how many explants I did. And I like that because that's a check and balance on me. When many people get started, they're like, oh, I'm the king of explants. But guess what? If he's doing end blocks and lifts in 3 hours, we know that's a big red flag. And I
Yeah.
tell the
No.
ladies, write about it so that the other patients get forewarned and
Well,
that
I
everyone
encourage that.
knows. Yes,
I
yes, because
encourage that in my group.
this is very important because now it boils down to the sincerity, the dedication, the motivation, the faithfulness, the religiousness of the surgeon, so that when he or she goes to the operating room, that they're going to remove the entire capsule. Because if they are
Yeah.
not, that is
I
not
know.
worth the operation.
Well, in my group, and I do this often, and they might now that you're listening to this, you might go, "Oh, that's why she does that." I say, "Tell us who did your explant, what they did, and how you feel." So I want to
Yes,
know who did it, how do you feel, what did they do? Because then there you are. Everyone can look and go, "Oh, they didn't get the whole thing out in an end block. Oh, they don't feel great. Oh, it was this doctor." Because honestly, that is the only way we're going to keep people in
exactly.
in a boundary here. Because what's happening is this is a new industry. It's a new way for people, for doctors to make a lot of money, and if there's not a sincerity to it, they become a mill, and then
Absolutely,
they're just
absolutely.
getting their
Because
money, just like putting
absolutely. At the
in
end of the day,
implants.
it's a business, it's a practice. And I want all the patients to be on top of this because I can only do 300, 350 a year. I have a full plastic
Right.
surgery practice, and I want to be able to teach, share this with the millions of others, who basically want to seek this knowledge and information so that they're basically well informed and they truly get comfortable
And
asking questions. Be direct. Don't be
you know
nice.
what?
Do your homework.
That's the responsibility of a group owner. All of these group owners, your responsibility is to bring truth to the people that are following you. Let them share their truth and share the truth so that everyone can see for themselves. I'm not peddling any lies here in my group. There's a lot of groups, they're allowing only certain things. And I try to, like I said, I try to just let everyone talk. If you had a bad experience, tell this person. If you don't feel good, let people know so that they can see what your mistake is. That's how we're learning from each other. And
Absolutely,
this,
absolutely.
even the doctors are learning. And as we talked about, there's even some detox stuff that you might not agree with that saved my life. And because
Sure,
we're on
absolutely. And
different,
you know
we're,
what we need to
yeah,
do, Darby? We need to do more research so that we
right,
can say, you know what, Darby was right, and this is what you need to detox because that's what it takes.
right,
And I will say this
absolutely,
to you, if I go right now to the big hospital right behind me and I get 1,000 doctors, and there are probably 1,500, 1,700 doctors affiliated with it, and if I line up 1,000 doctors and I ask
sure.
each one of them, what is breast implant illness? Do you agree
You'll
with
get a
it? Do
different
you believe it?
answer.
All 1,000 of them,
Yeah,
all of them will say, "What is this you're
yeah.
talking about? It doesn't exist, and this is all in the patient's head."
Right. And that's
You,
the other thing. That's another thing with detox. And all due respect, Dr. Khan, is you're in the medical world and you probably don't put a lot of stock or investment into all of the detoxing things that these women have done, because what you're doing is saving everybody's life, removing them. So this is a different aspect. So all of these women, the thousands of women that I'm meeting, they're all learning and researching for themselves. Each one of them, like myself, I've spent hundreds of hours figuring myself out and figuring out what makes me feel better. And that right there in itself, that's different. And it's a different aspect. It's two different sides to this. And I think that's what's important. It's like learning to work that synergy together. And that's a big thing, is that I see women, they get their proper explant and then they get their proper detox and they feel amazing. And those things, they go hand in hand. It's a beautiful thing, and it's amazing. It's just two different sides of the tree. Yoop,
sure.
yoop. Dr. Khan, you're amazing, and I absolutely appreciate chatting with you, and I so appreciate all of your knowledge, and I think everybody else does too. So I know we've got to wrap it up now, because after a certain time we do get, even if I add this to the live, we will get cut off, and I like to put them on YouTube too. So
Sure.
tell us
Now,
your
Darby, can
YouTube
I
name.
mention, and this is what you alluded to earlier, from the way it sounds, all of this, what Alicia had mentioned, this was on my Facebook page and not
Right.
on yours. I do not know if
No.
Alicia was able to put it on or no.
No, I
Alicia?
didn't see it.
No.
I didn't see it, and I couldn't find yours either, so I couldn't share it. So I haven't seen it, and none of my people are seeing it yet. But she and I can discuss afterwards and try to figure it out.
What I will do is this, so that your uh, followers and
Yeah.
I can certainly come on again, whatever questions that they have, because what I want to do is, as someone is following, I will answer the question as you read it and I read it, because I think that's an integral part, because many patients have a lot of questions. And I
Sure.
say, you know, these are very healthy discussions so that we learn and we help educate and we teach. And I will tell you, we talked about a lot today about the
Yeah.
reasons and what the qualities are, what to do, what are the detoxification, what's the best detoxification, and how, what your experience was, so that other patients can relate to it and say, you know what, this is what I need to do next, this is what is the best for me, and this is why I can say with certainty I have breast implant illness, because I don't have anything else.
Right. Absolutely. And you can check out biidetox.com. And there's a lot of great information on there too. So my nonprofit, between that and then my biidetox.com website, we have a lot of great stuff, and we'll be linking you up with some of those too. I'm trying to put all the really wonderful surgeons, so I have to work with your people for that too. So I really want,
Absolutely.
so people can reach out to you. And Dr. Khan, you're just so personable, and everyone who meets you on the group, and is getting explants. I posted up, we were talking today, and I had so many people so excited that they're explanting with you next week or the next week. And, you know, and everyone who works with you says the same thing. He really is just, he really believes in this. And there's a lot of passion and a lot of, you know, beautiful love behind it. And I just
No,
think that's
thank you,
so
thank you.
awesome. Yeah. And we so appreciate your time.
You know, I'm going to say this from the bottom of my heart. When you said initially, I will thank you very much for your time. You know, I signed up to be a physician to help, to from the bottom of my heart. I can only tell you, for example, if I did 10 explants a week, multiplied by if I worked only 40 weeks, right?
Mm-hmm.
400 times 5, that's 2,000. And if you can do the math, 2,000 just multiply by, and this is like literally working part time, you can see how much money there is involved in me physically, not, especially when I started my practice. And for me, from the very beginning, to not have implanted and to have only explanted and to have done the many other facets of plastic surgery, I feel in
And
my
some of your,
mind,
some people might not know that you have only ever put in one implant, pair of implants. It's because you had to do it to be
to get board
certified.
certified, and this was on a
Right.
cancer patient, and very early on I knew the detrimental effect of it. And I will just quickly go over this, take this time. Number one, implants are not meant to be forever. 7 to 10 years on average. Number two, if a young lady in her 20s gets it and she lives to 82, which is the average age of an American woman, 6 times she would have at least to change it in her lifetime.
Wow.
The way it obscures the self breast exam and maybe masking a mass that she might have felt, let alone the problems, let alone the lymphoma, BIA, breast implant associated anaplastic large cell lymphoma. Looking at all the problems that it causes, as you see the contracture, infection, scarring, asymmetry, the excess droopiness, for example, double bubble sign, and amongst the many problems. And look, so many posts in regards to almost 37% of the patients, at least in 5 years, who have had to do surgery in order to fix the problem, fat
Wow.
grafting, going asymmetry, amongst the many other problems. And look at the problems that we know of, that the manufacturers put out 1.8 to 2.4% getting connective tissue disorders, that has been
Wow.
declared very openly. And look at all the problems
I
that,
didn't know
you know,
about
this.
that.
Yeah,
Yeah.
and guess what? Can I say this, share this? Did you know, Darby, what is the FDA policy and protocol in regards to breast implant silicone? If a lady gets breast implants, for example, in the year 2000, according to the FDA, this lady should have had a MRI in 2003,
Wow.
and then every 2 years consecutively for the rest of the life of the implant that she's had. So if she comes sees me in the year 2020, she should have had six, eight,
That's not
nine
happening.
MRIs,
That's not
nine
happening.
MRIs in her last 20 years. And can you believe this is the official recommendation by the FDA? Now,
Let me just tell you why that's not happening. In my perspective, is because you go to your doctor and you say there's a problem, and they tell you that you're crazy, and you have to jump through hoops to even get an MRI or to get an
yes.
ultrasound. And these things, no one's working together. Also, the FDA, a while ago, I read on there, it said every 5 years you should get them you should get
No,
them
no.
redone. Just so you know, even though there's a lot of stuff that said 7, it said 5 years. I think eight
Wow.
months ago. So I'm thinking that they're not, working. None of these things are working in synergy.
And the,
None of these
and the,
things are
and the
meeting up.
insurance company always denies it.
Absolutely. And that's
Yeah.
just a shame. That's just a shame. Anyway, I know we've got to wrap it up now, but I'm sorry. I want to hear this last bit of this thought, because it sounds like it's going a magical way. So I'll let you finish
Yes.
that one.
Sure. I'm sorry, can you say that again, Darby, the last point?
Yes, I didn't mean to interrupt you. I wanted to hear what you
Yes,
had
yes,
to
so
say,
no,
but
no.
we have to
So no,
go.
I
Yeah.
just wanted to say this is very healthy. What we need to do is this, because I owe your followers, your members, Facebook Live, because they did not have a chance to hear me live. There's one
Yeah.
point that they see a video because they can always see one, but there is another point of basically going on live. So whenever your schedule permits, please email me, text me, or let me know, and we will certainly connect again. And what Alicia just told me via the feed, that she needs to get admin access to your Facebook page in order to link directly to your followers. and that's why we
Okay,
were
good
not
to
able
know.
to do so. Yeah, yeah.
Okay,
So
well, she and I will work that out. All right, Dr.
okay,
Khan, once again, you're lovely, and I just so appreciate your time. And thank you to your wife for sharing all your time with us. I know that this is valuable family time, so we just so appreciate you.
thank
And
you very much for saying that. I appreciate it.
we'll be talking to you again soon.
Thank you very much. Thanks everyone, and please share. Bye bye.
Okay, bye bye.